Hi friends, welcome to Physiodemic. In this video, I will tell you about the plantar fasciitis and how it is diagnosed and what are the treatment options available for the plantar fasciitis. So let's begin. Plantar fasciitis may be referred to as plantar fasciosis and plantar heel pains because may case diagnosed as plantar fasciitis are not inflammatory conditions. So plantar fasciitis is confirmed through histological analysis which demonstrates plantar fascia fibrosis, collagen cell death, vascular hyperplasia, and avascular zone. Now I will tell you about the etiology of the plantar fasciitis. So it affects up to 10 to 15% of the populations. Approximately 90% of the cases are treated successfully with conservative care, and it is most commonly experienced during the middle-aged. And the etiology of the plantar fasciitis are loss of ankle dorsiflexions and pes planus condition, congenital condition like pes cavus and pes planus, excessive foot pronations during the weight bearing activity, and plural weight bearing activities, and improper shoe. Now I will tell you about the clinical feature or clinical presentation of the plantar fasciitis. Patient usually complain heel pain with first steps in the morning, and the patient also complain tenderness to the anterior medial aspect of the heel region, and patient also complain tightness of the Achilles tendon or calf area, and patient usually the pain usually occurs in barefoot walking, and patient also shows limping gait while walking because of the pain. Now I'll tell you about the diagnostic procedure of the plantar fasciitis. So the diagnosis is based on the patient's history and physical examination. And windlass test is also a special test done to probe the symptoms at plantar fascia by creating maximal stretch of the plantar fascia. And diagnostic ultrasound and MRI may be also useful to diagnose the plantar fasciitis, and ultrasound confirm the plantar fasciitis by taking the measurement of the plantar fascia thickness. As ultrasound is non-invasive with cost effective and radiation free, so it is considered as the early in the diagnosis of plantar fasciitis. Now I will tell you about the treatment of the plantar fasciitis. So in medical management, basically NSAIDs, analgesics medications are given to the patient, and patient is asked to take rest and used a modified shoe. When these conservative measures fail, then the plantar fasciotomy with or without heel spur removal is done. That is surgery done when the conservative measures fails, and 70 to 90% of the heel pain patients can be managed by a non-operative measure. Now I'll tell you about the physiotherapy treatment. Once the patients come to the the therapist take a proper thorough examinations of the patient, and as per the requirement, different treatment techniques are used. And among these, the strength training is very much effective techniques which is taught and demonstrated to the patient. And in strength trainings, the high load strength training appear to be more effective, and which reduces the pain and improve the functions of the patient. So basically the intrinsic foot muscle strengthening exercise or toe crawling exercise is taught to the patients. Then the stretching exercise is also demonstrated and taught to the patient. These are the stretching of the plantar fascia and the gastrosoleus muscle stretching, and all the sets repetitions is taught to the patient. Okay, then the mobilizations and manipulations seems to be effective and used by many therapists to reduce the pains and relieve the symptoms in some cases. And the techniques used in manual therapies are posterior talocrural joint mobilizations, and subtalar joint distraction manipulation technique. Okay, and some therapists also recommend the posterior night splint to be used, and which maintain the ankle dorsiflexions and toe extension and allow a constant stretch of the plantar fascia. And other treatment techniques like modalities to reduce the pain and inflammation of the patient, ultrasounds, IFT, TENS modalities are used. And some of the therapists also tell the patient to do foot massage with a bottle filled with cold water or hot waters. And other therapists also use tapping techniques and shoe modifications, and there are many other treatment techniques are there, and I will tell you about the all the evidence based practice available for the plantar fasciitis treatments. Now I'll tell you about the evidence based practice for the plantar fasciitis physiotherapy treatment. So the posterior night splint is generally recommended by many therapists, and there is very limited evidence is there to support the use of posterior night splint to treat the patient when the patient is having pain since from the 6 month. Okay, then acetic acid ionotophoresis and tapping technique is also used by many therapists, and this both the techniques combinedly uh, gives greater relief from stiffness and pain as compared to the ionotophoresis by dexamethasons and tapping techniques. Okay, then foot orthosis produces short-term benefits in function and small reduction in pain and don't have long-term beneficial effects. Then short-term treatments with tapping for 1 week might elevate the pains better than traditional program. And the prefabricated shoe in short is better than the custom propylene orthotic device for improvement in symptoms of the patient. So these were all about the uh, treatment options available for the plantar fasciitis conditions. So thanks for watching this video and stay tuned to the Physiodemic for further new updates. Thank you.